Left of the box. So I'm going to get into a story now about you'll hear this in two phrases. So safe consumption sites and supervised consumption sites. They're basically the same thing. The more appropriate term, I think, is supervised consumption sites, or SCS for short. And these sites save lives. They absolutely save lives. And Doug Ford has just shut down more than half of the ones in this province. This will cost lives. So I've put together a whole bunch of information because one of my frustrations with Canadian media is there's no one article you can go to that will give you all the information you want. You have to kind of pick pieces here and there. So I have like a whole bunch of articles I want to get to, but just bits and pieces of them, to give everyone like a very full and broad story as to what is happening and how this is going to impact people. And, you know, even as I'm looking at this YouTube video that I'm about to play, there's another one off to the side in the recommend saying gravely concerned Thunder Bay's only safe drug injection site being shut down. You know, when you get to the northern areas and their only safe supervised consumption sites are being shut down, where do you think those people are going to go? What do you think is going to happen to them? So we'll start with a video, and then we'll get into some news headlines, more video, back to Doug Ford at that horrendous press conference he gave. But yeah, this is just a devastating, devastating story. And like I said, this will cost lives.
This was taken in 2017, maybe a year before he passed away.
Marie McKenna thinks of her son Corey every day, but especially on August 20th.
Today would have been his 35th birthday.
Corey Smigelski died of fentanyl poisoning 6 years ago, one of the more than 40,000 Canadian victims of the opioid crisis.
For 4 years, he tried and tried and tried to get clean from this very, very toxic drug.
Now a major change in how Ontario deals with the toxic drug crisis, the province banning all supervised consumption sites within 200 meters of schools and childcare centres.
The cycle of addiction is not being broken by using drug consumption sites.
There are 17 of
Yeah, they are. And like the thing is that a lot of the locations for these consumption sites are in areas where they're needed, where there's high drug use, where they're accessible to people, where it's by other resources that people need. Like these aren't just randomly placed by a school. They're in areas where they would best serve the public.
these sites across Ontario, where users can get their drugs tested for toxins and get emergency care in case of an overdose. 10 will now be shut down. The province ordered a review of all the sites after Toronto mom Carolina Hubner-Macarat was killed outside one, hit by a stray bullet in what police say was a battle between drug dealers.
Not sold on these safe injection sites.
And that is a tragic, horrible story. It's not necessarily related to the safe consumption site. It was a drug war. Again, these sites are in areas that have problems already. They don't bring new problems to an area. They help people who already live in those areas. And it is a tragic story of what happened to her. But to blame it on the safe consumption site that's busy saving lives is so disingenuous and so harmful. And it stigmatizes the people who then go and use these sites.
In what police say was a battle between drug dealers.
Not sold on these safe injection sites that are in neighborhoods that needles are all flown around. It's a haven for drug dealers, in my opinion.
The province is instead promising 19 new addiction treatment.
In his opinion. Did you catch that? He said in his opinion. We're going to get into how many experts were participating in this, but that's just his opinion that these aren't safe places, all the needles and things of that sort. And to point out, oh, well, maybe there's a needle in the park. Do you know what I remember coming across in parks the most when I was a kid? Beer bottles. All the time in parks. And sometimes those beer bottles were smashed into bits and pieces in the sand. That's what I remember. I don't remember needles all over the place, and I'm sure that is a problem in some areas, but it's this double standard that Doug Ford has that is so disgusting, because here it is, oh no, drugs are so bad, and yet he's expanding the use of alcohol. You know, he's making it so people can go to a 7-Eleven, sit down and get drunk. Bars are supervised consumption sites for alcohol. What do you think would happen if suddenly you shut down all the bars? Where do you think those people would go to drink? What do you think would happen to the neighborhoods if there was suddenly nowhere for people to go to have alcohol? If there weren't people that were required to have their smart serve in order to serve alcohol, what do you think would start happening? And he's expanding those because it lines the pockets of his buddies. Like, I'm surprised he's not pushing to legalize drugs so that he can line the pockets of more of his buddies who will then get into that business. But because the sale of alcohols will help line the pockets of his buddies, he's expanding those. And I guarantee you a lot of those places where you have supervised consumption of alcohol are within 200 meters of a school. You know, there's no restrictions on those.
Dealers, in my opinion.
The province is instead promising 19 new addiction treatment hubs with supportive housing.
They will not provide safe supply, supervised drug.
So if you're not going to supply safe supply, what does that leave you with? If you're not going to make sure that the supply they have is safe, then you're going to leave people with unsafe supply. But I'll let her finish her statement because it's really, really horrible what she's saying.
The province is instead promising 19 new addiction treatment hubs with supportive housing.
They will not provide safe supply, supervised drug consumption, or needle exchange programs.
It's absolutely.
So basically nobody will use them that's in need. Like you're saying, you have to go cold turkey from your addiction in order to come here to get help. That's not the best way to encourage people to go to that facility to get help. It's not. You can't tell people to just cut off your escape, because a lot of people are, you know, in depression, despair, things of that sort. It's the only way that they can cope with their reality. You can't tell them to take away their one coping mechanism, their addiction, to fight that. When they're in vulnerable situations, it needs to be multi-layered help. But to have them shipped off into some location where, you know, at any slight transgression, they would be kicked out. Like if they would monitor the drugs that go, like they would monitor people to make sure drugs don't get in. If you get caught using drugs, then you would get kicked out of the program. A lot of these programs have things like curfews, and you're taken away from your connections, your friends, your family, all that sort of stuff. You're isolated away from them. Like that's what a lot of these programs do. And for some people that could work. So it's not that these are horrible things to put in place, but it's just, it should be another thing that they use along with supervised consumption sites. Both options should be available. It's not an either or thing.
Callous and it's negligent.
This community worker says Ontario's move will make drug use more dangerous.
We want to make sure that toxic drugs are not killing people, and in this case, we're going to see a lot more death as a result of this scheme.
Marie McKenna believes the supervised consumption site could have saved her son.
If Corey had had that drug tested that day, he'd be alive today.
Instead, his mom marks another birthday without him. Mike Crawley, CBC News, Mississauga, Ontario.
So from CP24, detrimental impacts, Ontario announces closure of 10 supervised drug consumption sites. So this is just more information on the whole situation. The province's decision to close 10 sites offering supervised consumption services, SCS, across Ontario, including 5 in Toronto, will have far-reaching detrimental impact on our communities, says the chair of the Board of Health, City's Board of Health. Last year, there were 524 opiate intoxicity deaths in Toronto. 524 people died from this. It's clear that more action is needed from all orders of government to assist this crisis, said Toronto City Councillor Chris Mose, who added that these sites provide critical services to people who use drugs and have saved countless lives in Toronto and across the province. And as that woman was saying in the previous video, had that one time her son had taken those drugs, had it been tested to make sure that it was, not mixed with other things that could be potentially lethal, he could still be alive. And that means it's a matter of surviving to the next day and the next day and the next day until finally something happens that can help you break out of that cycle. And it can take a lot of time and a lot of work. But when you remove these safe consumption sites, you run the risk of dying. And when you're dead, you don't have the ability to get better. That's not rocket science there. But this will just end up with so many more people dying that will never get the chance to get to a place where they can finally be, addiction free. And these safe consumption sites, these supervised consumption sites, they do more than just, here's a place where you can shoot up. They offer supports, they offer help, counseling and all that sort of stuff. It's not like, oh, just come in here, shoot up and walk out. They have the resources so that when the person is ready, they can go in and get the help that they need. To try to force this on people does not work, because you have to wait until that person is in a situation where they're able to go through the trauma of beating these addictions. So research indicates that SCS are successful in reducing drug-related harms. They provide immediate response to overdoses, which significantly reduce death rates. They also reduce public drug use and associate issues such as discarded needles. Closing supervised consumption services will not stop people from using drugs. If sites are forced to close, we will see more public drug use in our parks and in our laneways. We will see more discarded needles on the streets. We will see increased risk of transmission of infection diseases due to shared needles such as HIV, Hep C, and we will see more overdoses and deaths. In a joint statement, Mayor Olivia Chow said any change to evidence-based harm reduction programs should be in consultation with Toronto Public Health. So read her joint statement with Chris here. Last year alone, there were 524 opiate toxicity deaths in Toronto. There's no question that more provincial funding for treatment services and supportive housing is necessary and welcome. We urgently need more provincial support to help people access treatment, housing, and social services. However, any change to evidence-based harm reduction programs should be made in consultation with Toronto Public Health. Should be made in consultation with? So are you saying it wasn't? That Doug Ford just did this without consulting? Shocker. And you'd be shocked when you hear him say, we were talking to all the experts about it, as we'll get into. But the statement continues, we are concerned that the provincial closure of existing harm reduction services will have significant consequences, such as more overdoses, strain on police, fire, paramedics, and all that sort of stuff. And I wanted to get down to, aside from shutting down supervised consumption sites near schools and childcare centers and mandating additional safety and security measures at the remaining ones, the Ontario government also said that it would be introducing new legislation this fall that aims to prohibit municipalities or any organization from standing up new consumption sites or participating in safer supply programs. So they're going to ban the creation of them, regardless of where they are. So a lot of these sites that are being closed down, they can't just then move, further away from the school or something, because they're going to be prevented from going up in the first place. This soon-to-be proposed legislation also calls for the prohibition from municipalities from applying for drug decriminalization exemptions from the federal government. So sometimes the conservative governments get so bad that the federal government has to do workarounds to help municipalities. So they bypass, the provincial government and go straight to the municipalities to help them out with instances. And here they're saying, no, we're going to also try to pass legislation that will prevent the federal government from stepping in and helping these municipalities with what they deem is best for their community. So here is Doug Ford forcing his will on municipalities. He's ignoring what these municipalities are saying are the best use of their resources, the best way that they have to combat the issue of drug use. So ban on supervised consumption sites closes locations for government previously approved. Many of the supervised consumption sites, and this is from Global News, many of the supervised consumption sites where addicts can safely take drugs to avoid risk of overdose were approved by the very same government that's now looking to shut them down amid public safety concerns. So again, this is another massive U-turn from Doug Ford, because this is something he was already okay with, but now suddenly, with the expansion of the alcohol to all these stores, he wants to get rid of these. Funny coincidence, that is. In fact, more than half the 10 sites announced for closure by Health Minister Sylvia Jones on Tuesday were opened and funded by the Ford government in early 2019 as politicians grappled with provincial overdose crisis. Despite opening and funding many of the centers and now plans to close, the government said its new policy was about doing more to protect public safety. The policy shift unveiled Tuesday means supervised consumption sites within 200 meters of schools or child facilities will be closed by next March. The policy has been criticized by proponents of the facilities, which say they have saved countless lives from fatal overdoses that have become more common with increasingly contaminated drug supply. So then there was a statement from Doug Ford on the hostile fart sauna. Doug Ford, it's talking again. I don't understand what it is about these, fascist right-wingers and talking about themselves in the third person. It makes no sense to me. Like, if I ever start, doing my live stream saying, Sandy is now going to be talking about safe consumption supply, and Sandy is feeling sick today, help me. Like, there's probably something wrong if I start talking about myself in the third person like that. Anyway, Doug Ford believes in rehabilitation and being responsible in all areas of government. Doug will work with the experts to get where we need to go. He will work to save lives and help people. Well, the supervised consumption sites are saving lives and helping people. And he says, I do not support injection sites, but I do support rehabilitation programs that get people off drugs. I will work with the experts. He'll work with the experts, he says, and get to where we need to go. Save lives and help people. Doug Ford says that he will work with experts. Experts did not recommend closing Leslieville drug consumption site. Consumption treatment services are a necessary public health service, says report commissioned by province. So this is from a report commissioned by the province. The Ontario government's decision to shutter multiple supervised drug consumption sites in Toronto runs counter to the expert opinions it sought about one of those sites. So closing this. So he says, I will work with the experts. So he says he will work with them. He never said anything about actually listening to them and following their cues, I guess, is what it is. Counter to the experts' opinions, it sought about one of those sites. After Carolina was fatally hit by a stray bullet while walking in Leslieville in July 2023, the Ministry of Health commissioned 2 reviews into supervised consumption and treatment services operated out of the South Riverdale Community Health Center. The 2 reviews were quietly posted online earlier this week. Both of them recommended changes to the operations of the center, and both recommended the province expand harm reduction resources, consumption and treatment services included. Evidence shows that consumption treatment services are necessary public health service implemented to save lives and prevent accidental overdose deaths, says the SRCHC supervisor's report dated April 2024. So the experts are saying, yeah, sure, do this other program that you're thinking of, where people can get locked away and go cold turkey and stuff. Because again, like I'm saying it a bit dismissively, but those types of programs do help some people, so they are valuable. But here's the report saying, well, we should also be expanding consumption and treatment services. And Doug Ford is not listening to those experts. He's working with them, not listening to them. More from Global News. Didn't talk to us in advance. Ontario's supervised consumption site surprised by shutdown. Bill Sinclair was surprised and upset when he saw the name of the Toronto Overdose Prevention Centre he runs included on a list of similar facilities in Ontario the government has ordered to close. So he didn't even talk to the people who run these sites. But he's so sure in his opinion that they're bad. He didn't talk to the experts. He didn't talk to the people who run these sites. The Kensington Market Overdose Prevention Site, run by Neighbourhood Group Community Services in Toronto, is one of 10 sites across the province that will be forced to close before next April because they're located close to either a school or daycare center. I was surprised about the entire announcement, Sinclair, CEO of Neighbourhood Group Community Services, told Global News. They didn't talk to us in advance. They didn't contact us before, since, or after. So who was he talking to exactly? Well, maybe he was talking to CAMH, the Centre for Addiction and Mental Health. That's a very well-known organization here in Ontario. It's very prominent. Read our statement in response to today's announcement about supervised consumption sites in Ontario. CAMH statement about the loss. Okay, so they welcome the government's investment today in housing and addiction treatment hubs. Those are those heart buildings that they were talking about earlier. We hope that this investment will be used to improve access to treatment and implement novel approaches that meet people where they are. And again, I'm a fan of that. Expand the different ways people can get help because different people require different supports. However, we are concerned to see the closure of several supervised consumption sites. Supervised consumption and needle exchange programs are essential healthcare services. They are evidence-based and life-saving interventions known to reduce the incident of fatal overdose, help reduce the transmission of HIV, hepatitis C, and other bloodborne infections, and increase referrals to treatment. They are a necessary part of comprehensive response to the drug toxicity crisis. The loss of supervised consumption sites and needle exchange programs will cause harm to people, communities across the province, but put pressure on other parts of the healthcare system, including already busy emergency departments, emergency medical services. We hope the Ontario government will maintain these services as part of the new hub model. Who did he talk to? Who? From the sounds of it, he wasn't talking to any experts related to the field. He wasn't talking to the people who run these sites. He wasn't talking to mental health professionals. He wasn't talking to experts. So what experts was he talking to? Was he talking to the experts who run corporations that are like, yeah, this doesn't help us with profit, so we don't want them around. Instead, just go and expand all the alcohol. Expand it so that, because it's not like there's a problem with drunk driving in this province. He bought those 5 new helicopters for $134 million to help with drunk driving. Because, there's an issue with drunk driving in this province and intoxicated people and people getting drunk, going home, abusing people. There's bar fights. That's a problem. People who are drunk and get into accidents. That's a problem. But all of that is okay. but safe consumption sites that save lives. That's not okay. Those are the harbingers of destruction and despair in communities, not a way to help support them, according to him, in his opinion. And if this wasn't making you mad enough, he had more to say about it at that press conference he was at earlier when asked about it. And to put it quite plainly, Doug Ford is an asshole.
Please identify yourself by name and outlet. It'll be one question, one follow-up. First question.
Thank you. Premier Mark McAllister from City News.
Hey, Mark.
Obviously, there's a number of questions from my colleagues and I about the announcement yesterday regarding the safe consumption sites. At this point, it sounds as though you want them to make the transition into the heart hubs, as has been announced as well. Just curious what your thoughts are. How do people who refuse treatment go about making that transition themselves? How do you get them into programs and services that you want them to get into?
Well,
Yeah, good question. You do that by having a place that they can go to that they feel safe and secure at, that they can have their drugs tested to make sure that there's nothing in it that would be extra harmful. And then you support them over time so that they get comfortable with people and actually feel like they can turn to them for help, as opposed to, just plucking them out of their communities and throwing them into one of these heart hubs. Kind of what those supervised consumption sites offer.
something, I just don't believe these safe consumption
Is that you go about making that transition themselves? How do you get them into programs and services that you want them to get into?
Well, something, I just don't believe these safe consumption sites. I've listened to the people and
Yeah, I've heard stuff. I just don't believe it. I choose not to believe it, is what he's saying, basically. It's just his opinion. He doesn't believe it. He doesn't believe these sites help, despite overwhelming evidence that they do. It's kind of like people who just still choose to not believe in climate change. It doesn't matter, that the forests by their homes are burning down every year. It doesn't matter all the flooding and storms that are happening. I choose not to believe in this whole climate change stuff. Well, here he is, the premier of this province, just choosing not to believe in safe consumption sites. It's just his opinion because he's an expert on this. And in actuality, he is, because those of you might remember his brother, the crack-smoking mayor of Toronto.
the neighborhoods. I've consulted with them. I've been getting endless phone
That you want them to get into?
Well, something, I just don't believe these safe consumption sites. I've listened to the people in the neighborhoods. I've consulted with them. I've been
Didn't talk to us in advance. Experts did not recommend. So he didn't consult them and he didn't listen to them.
getting endless phone calls about needles being in the parks.
So here he is again with those endless phone calls. We just heard him say the exact same thing when it came to people wanting Fred Hahn to step down from as union leader. Doug Ford saying, I'm getting all these phone calls about it. Here he is now saying the exact same thing. I'm getting all these phone calls about it. Prove it. Prove it. Okay? Like, he just says this as like, oh, I heard somewhere on some forum. And still, even if he was, so what? You know what? A lot of NIMBYs won't want any sort of safe consumption sites within like a half-hour driving distance of their home. You can't listen to the people that aren't directly affected by these things. People who are just upset that, it might make part of their neighborhood a little less appealing to them. Like, those aren't the people, those aren't the experts you should be listening to. It's the people whose lives are in danger, whose lives will be saved by these sites. The experts in mental health and addictions. Those are the people you should be listening to, not some fucking NIMBY that's upset that there might be one somewhere in their neighborhood that they would never know if they walked by it.
Needles being by the schools and by the daycare. That's unacceptable.
So when you get rid of the needle exchange programs that these sites offer, where do you think those needles are going to go that people end up using? It's not rocket science here. These sites help prevent needles from getting onto the streets.
What we believe in these heart hubs is we're putting $378 million into supporting people with primary care, mental health services, addiction care and support, social services, employment support, shelter and transition beds, supportive housing and other supplies and services. And
A lot of the mental health issues, like treatments, should already be available to people. They're not. Housing, supports, access to full health care, not having to live on the streets, all of that would help with the reduction of drug use. Not having incomes that doesn't leave you in dire poverty. All of that would help with drug addictions. It's a societal issue. It can't just be fixed by grabbing a few people off the street and putting them into these heart houses hubs that he has. You have to deal with the underlying cause of it.
including naloxone and on-site showers. So, giving someone, an addict, a place to do their injections, we haven't seen it get better. This was supposed to be the great.
It got better. It got better by giving them a safe place to do their injections. And again, what's the counter of that? Oh, a safe place for them to do this versus what? Not safe places for them to do this. What is better in that situation? A safe place for them to use their drugs or a not safe place for them to use their drugs? Which is better?
Greatest thing since sliced bread. It's the worst thing to give someone, an addict, a place to do their injections. We haven't seen it get better. This was supposed to be the greatest thing since sliced bread. It's the worst thing that could ever happen to a community.
I hate his folkiness. This was supposed to be the greatest thing since sliced bread. Who said that? Who? That's not a thing. It's not a thing.
To have one of these safe injection sites in their neighborhood. The other problem I have was with the federal government.
Ooh, here we go.
Safe supply. They get to go up there and get endless amounts of drugs. And guess what they do? They go out and they sell it and get other people addicted. And then they go and get even stronger drugs. But as far as I'm concerned, the federal.
So he's accusing the federal government of just handing out drugs to people who want them. That's not how that works. That's not a thing. People don't go to the federal government just to be given drugs that they can then turn around and sell. That's not a thing. He is lying. This is just a flat out lie. This isn't a thing. People don't go to safe consumption sites, to the federal government, to get safe drugs, as he says, safe drugs, and then turn around and sell them. That's not how it happens. Nothing like that happens. And here he is just lying about it. And do you think the reporters are going to push back on this? Do you think they're going to fact check him on the spot? Of course not.
Federal government, they get to go up there and get endless amounts of drugs. And guess what
Nobody
they do?
does.
They go out and they sell it and get other people addicted.
Do you know what? It would be nice if we could rely on the federal government to get all the drugs we need. Pharmacare. That would be nice. Like, seriously, I can't get my prescriptions for free. But he's here saying, oh yeah, people just get like endless supplies of drugs. Really? It would be nice if we could actually have an endless supply of drugs in this country. Pharmacare. That would be nice. It would be nice.
And then they go and get even stronger drugs. But as far as I'm concerned, the federal government's the biggest drug dealer in the entire country. It's unacceptable. It needs to stop. We need to get rid of safe supply. We need to put money into treatment.
We need to get rid of safe supply. Safe supply. We need to get rid of the safe supply. Again, what's the counter to that? What's the opposite? Unsafe supply. We need to let them have the drugs that will more likely kill them. that have additives to it to make them stronger, things that make them far more deadly. We need to be making sure that these people get unsafe supply as opposed to safe supply.
As far as I'm concerned, the federal government's the biggest drug dealer in the entire country. It's unacceptable. It needs to stop. We need to get rid of safe supply. We need to put money into treatment, detox beds. That's what we need to do, not continue to giving people free drugs.
Free drugs in this country would be a nice thing. It's just unbelievable that he can get up on stage and lie like that. Just blatantly lie like that, and nobody is pushing back. Like, where's the journalist saying, can you point out exactly where it is that the government is giving, the federal government is giving unlimited drugs to people? That there's no regulation around that? The liberals famously known for lack of regulations. Can you point out exactly where people are going to get this unlimited supply of drugs that they then turn around and sell? Why aren't the reporters pushing back on that? It simply doesn't happen. But let's actually get to some of the facts, the data, the actual research on this. So this is from the Government of Canada webpage. Supervised Consumption Sites, Understanding the Data. And this was last updated August 22nd of this year. So just yesterday. It was updated yesterday. Data on supervised consumption sites in Canada, including number of visits, client demographics, client safety, drug use, and overdoses. So what they track, total numbers of visits, numbers of different clients, all that sort of stuff. And then they have the definition and the indicators. Okay. Yeah, interesting. Oh, service referral provided. Oh, any referral made on health or service supports not directly related to drug consumption that are offered within the same building as the SCS, but not in the SCS space, for example, SCS, which is attached to a community health center. This can include wound care, testing for STBBI, sexually transmitted and bloodborne infections, primary health care, mental health care, food and shelter services, legal aid, employment assistance, and other services. So a lot of these consumption sites are near these resources that people tend to need. Service referrals provided offsite. So this tracks all the referrals that people are being given. The average visits per day, drugs used. So this is tracking all of that, data limitations. Each SCS provides standardized data report to Health Canada every month prior to March 2020. Okay, interesting. Some related links. Contact. Non-fatal overdoses. Number of drug overdoses that took place in an SCS. So this is being tracked during the reporting period and which did not result in death. To date, nobody has died of an overdose in an SCS in Canada. I'm sorry, when was this updated? Oh, yesterday. Okay, so this was updated yesterday. So at these sites, to date, as of yesterday, nobody has died of an overdose in an SCS in Canada. Not just Ontario, but in Canada. And he's closing these sites down. There were plenty of drug overdoses in these sites. And those people were saved. They got to live another day. Hopefully, they live long enough to get to the point where they're ready to receive treatment. But to date, nobody has died of an overdose in an SCS in Canada. And he's just shutting that down. So many people will die as a result of this. And this is from Trillium. It's a long article. Lots of detail, and is a good resource. So Ford government to close 10 supervised consumption sites, ban new ones in favor of hub model. But I wanted to get down to that section that I had up on screen. Treatment unavailable to many advocates. So Cola and Zoe Dodd, a harm reduction worker and researcher in Toronto, each said they'd welcome increase in treatment, which currently which is currently difficult to access, has gotten worse under the Ford government, according to COLA. So, normal treatment is difficult to access and has gotten worse. Because remember, Doug Ford likes to cut back on healthcare and treatment and mental health care and all that sort of stuff. Programs which would have been helping a lot of these people. But it's been getting a lot worse under Doug Ford. It tends to be one of those things that gets announced in good news announcements and then never actually turns into anything on the ground. So that heart hub that he's been talking about, believe it when you see it. They've announced it, but, the Liberals do this a lot too. They like to announce things, but then never get around to actually enacting those things. But everyone remembers the announcement, and nobody pays attention to the fact that it never actually went through. So with these heart hubs that he has, believe it when you see it, because he loves to announce these things. There's no guarantee it's actually going to happen. Dodd said she's helped multiple people access treatment. To get into residential treatment, you must have detox, she said. Someone in Toronto might do so at CAMH, so that was the Center for Addiction and Mental Health. Someone in Toronto might do so at CAMH, one of the small handfuls of detox sites in the province with medical staff on hand, she said. But after 10 to 12 days, that person will be released to wait for 6 to 12 months for a treatment bed. So they go to this place to get detox, but then to actually deal with the underlying addiction can take another year. In that time, without any other proper supports, most people go back to using drugs, she said. And that's in Toronto. The treatment journey for someone in Timmins, which still has residential treatment facility and hospital, can be 1,500 kilometers, its mayor said. It's even more difficult in rural Ontario. It's a very broken system, Dodd said. It's not like right on the spot someone will talk to you and have something for you. That does not exist anywhere, she said. Every day, people are voluntarily trying to get the support they need, whether through the medical system, hospitals, CAMH, wherever, and they can't. And from a mental health perspective, I can contest to this, that I have been in mental health crises, like severe needing help. And I have tried to access help in those instances, and nothing has been available to me. The programs simply don't exist, or there's not enough room. Treatment also varies in quality around the province, the experts said. One might be able to skip the line with a $30,000 treatment center, but it might not have medical staff on hand, Dodd said. Otherwise, a free 12-step program might be their only option, she said. And then people are told that they're failures because they don't do well in these programs. But actually, the programs haven't changed. They're quite archaic and built off a model that was created in the 1950s, Dodd said. While treatment beds are important, clinical guidelines say the first line of treatment is opioid agnostic therapy, which is medication included suboxone and methadone, ideally combined with counseling, said Leah Simone, the Associate Medical Officer of Health at the Simone Muskoka Health Unit. In my opinion, everyone in Ontario who has an opioid use disorder should have access to that kind of treatment, she said, speaking at the AMO opioid panel. There is no debate. CTS sites save lives. Connected, so consumption treatment sites save lives, connect people to services. Toronto's the workers site has intervened in over 2,300 overdoses since it opened. Ottawa's Somerset West has stopped 1,700, Cola said. CTS sites have been studied all over the world, added Simone. Bottom line is there's really no scientific debate. It works, she said, adding that it lowers rates of overdose, death, and bloodborne infections. And importantly, we know it increases the likelihood of them connecting with other services when they want it. People are going to die. because of what Doug Ford did. And it's not just Doug Ford. It's any province with conservative leaders. It's the federal government. Like, Pierre Poilievre wants to get rid of these sites across the board, across Canada. It's conservatives that want to punish people for being addicts in the first place, because that's all that's going to happen is they get punished. But the circumstances that led to them having the addiction is never dealt with. But like I said, it's not just Ontario. So this is from The Breakdown, a wonderful site, Twitter follow from Alberta. So Danielle Smith, that's the Premier of Alberta, said the quiet part out loud. On Friday, she said she would use the notwithstanding clause to implement her Compassionate Care Act. And we'll get a little bit more into what that was, which is a tacit admission that forced treatment is unconstitutional. So she wants to use the notwithstanding clause. And what the notwithstanding clause does is supersedes people's constitutional rights in this country. So when the courts, settle in favor of people's constitutional rights, the notwithstanding clause can be used to override people's rights. And by saying she's going to use this is admitting that these forced treatments is unconstitutional.
Part of what the Sovereignty Act is attempting to do is to be a notwithstanding clause on federal law. Because the notwithstanding clause is written in a weird way. The only time you can use the notwithstanding clause is to protect your own legislation. Now, we may have to use it on the Compassionate Care Act, because if we're ordering people into care for 90 to 120 days.
If we're ordering people into care for 90 to 120 days, remember the Compassionate Care Act in the article? It's forced treatment. It is forcing people into treatment centers. If we're ordering people into care.
The federal or the courts might not like that.
Yeah, the courts might not like that if you force people into that, huh? Yeah, courts might not like that. Yeah, they might not like you trampling on people's constitutional rights.
That would be the kind of case where we would say, notwithstanding what the court says, we think it's important to order people into care.
Notwithstanding what the court says. Notwithstanding what the court says. So even though the court rules that way, we think it's important to order people into care.
Important to order people into care. But I don't have the ability to use the notwithstanding clause to override federal legislation. The federal government has something in the Constitution called disallowance. And what it is that if we tried to pass legislation, like we tried to once to set up our own currency, that is in their area of jurisdiction, they have the ability to disallow it. So what I'm using the Sovereignty Act for is the...
So yeah, it gets a little bit into the Sovereignty Act, where she basically wants to separate Alberta from the rest of Canada, to not let the federal government have any say on what happens in that province whatsoever. Even wants her own currency in that province. But, if the federal government comes in and says anything, they want to be able to say, nuh-uh, we aren't going to do it. But let's get back to the Compassionate Care Act. Smith says Compassionate Intervention Act is a last resort in Alberta. And this is from last year, so April 24th, 2023. Alberta Premier Danielle Smith said the proposed Compassionate Intervention Act is a last resort if the province exhausts all other options to help those struggling with addictions. The act, first reported by the Globe and Mail on April 18th, would give police and family members or legal guardians of drug users the ability to refer adults and youth into involuntary treatment if they pose a risk to themselves and others. And who gets to determine that? Because involuntary treatment, that helps all the time. That's how it happens. Yeah, you just force people into these centers, traumatize them, remove them from their environments and force them into an unfamiliar place, and that will help. Yep, that's what you need to do. Just do like a little conversion therapy there. The Globe and Mail also reported the government is expected to introduce the bill later this year. The policy, the first of its kind in Canada if passed, is part of the United Conservative Government's model of recovery and treatment while stripping down harm reduction resources like Supervised Consumption Sites, SCS. So, we're going to force people into treatment, but we're also going to get rid of Supervised Consumption Sites. Yeah, intervention would be forced, but treatment is voluntary, she said, citing Portugal as an example of the successful model. Yeah, we're going to forcefully put you in a treatment center, but then after that, if you don't get better, well, oh well. It's not just Alberta. We also have the serfs. I know this is near Lance for personal reasons, and he says safe supply and overdose prevention kits have saved thousands of lives. The data is very clear on this. You sick freaks just want to make poverty porn and scare people into thinking it's not your horrible policies exacerbate the problem and get more people killed. And this is from the Conservative Party of BC will end David Eby's deadly drug experiment. We will fund treatment and help British Columbia recover with common sense plan. Similar to what Ontario is doing, no doubt, to just get rid of those safe consumption sites. So this is somebody whose life was saved because of these sites. So Guy Felicia, I guess, trusted harm reduction and recovery expert, inspirational speaker, sharing my story of overcoming addiction, mental health, and homelessness. And this was back in July 25th of 2020. Not bad for a guy who had to brought back to life 6 times and struggled with homelessness and addiction for decades in DTS. I wouldn't be alive today without harm reduction, and I wouldn't have the life I have today without my recovery. And there he is with his family, and he's saying, in response to all that's happening here, I wouldn't be here without supervised consumption services. Neither would my kids. How many future families like mine wouldn't be a reality because of the Ontario government's Sylvia Jones Doug Ford announcement today to close 10 out of 17 supervised consumption sites. Apparently he did it for the children. Doesn't look like it from where I'm standing. He's an example of what happens. 6 times, he said. He had to be brought back to life. Because it doesn't happen overnight. You don't get better overnight. You don't, no treatment just magically works. It takes time and effort and energy and different tactics. And I speak from a mental health perspective of dealing with my own mental health issues. There is no magical cure out there for people when it comes to mental health, when it comes to addiction, and addiction is a mental health issue. But he wouldn't be here. His family wouldn't be here if it wasn't for the services these sites provide, and Doug Ford is going to get rid of them. People are going to die from this. The situation is going to get worse. There's going to be more needles, more diseases being spread, more people in despair, and this is on top of everything else I've been reporting on this channel, the amount of people who have become unhoused under him, the amount of people without family doctors, a lot of these programs you get referred into, you need a family doctor for that. He's making treatment impossible and then blaming people for being ill in the first place when, the lives that they have in this province have just gone to shit. A lot of because of what Doug Ford has done. It is disgusting that he's allowed to be getting away with this over and over again. Oh, it's just so frustrating that more people aren't calling him out, that the reporters aren't calling him out. Point to these endless supply of drugs from Justin Trudeau's federal government. Is it Justin Trudeau himself handing them out? Is that it? You go trick-or-treating at his place and he just dumps drugs into your bag? Be specific with it. Where are people getting this endless supply of drugs? And can you let me know where that is? Because I have medications I could use an endless supply of.